Cervical cancer is a cancer that begins with the uterine cervix, the lower end of the uterus that contacts the upper vagina. Cervical cancer remains a common cause of cancer and cancer death in women in developing countries including Ghana. The condition is caused by a virus called the human papilloma virus, HPVs, and without access to screening or vaccines, it can lead to death. Speaking to the principal nursing officer of the Reproductive Health Center at the Kolebu Teaching Hospital, Madam Rose Adofo narrates how one can contract the disease.
The virus through sexual interaction. And so it is to say that it's a sexually transmitted infection. So that when you meet a yaw who has also been exposed to the virus and maybe we have sexual activity or sexual intercourse, then it is likely I may contract that virus. And the amazing thing about the virus is not immediately you come in contact with it or you get exposed to the virus, then the signs and symptoms begin to exhibit. It goes through a transitional period of about 10 to 20 years. Exactly. So it would amaze you to know that a number of women, a number of men could be walking around with the virus. But because in the meantime it hadn't posed any problem, you wouldn't report for it.
Disease has its risk factors such as people with a compromised immune system, family history, being obese, persons who are sexually active and are exposed to sex at a very tender age, among others. It has symptoms like abnormal vaginal bleeding after menopause, vaginal bleeding after sex, bleeding or spotting between periods, longer or heavier menstrual periods than usual, abnormal vaginal discharge, and pain during sexual intercourse. Statistics available at the Reproductive Health Center, Kolebu Teaching Hospital, indicate that about 300,000 women die of the condition annually out of the 500,000 cases recorded at the hospital. In 2017, out of the 1,500 cases screened at the facility, 150 women were confirmed positive.
Kolebu is a teaching hospital, like you all know, for that matter, referral center. Last year, in this particular department, Productive Health Center, we screened about 1,500 cases. Out of the 1,500 cases, we had about 10%, so that is 150 that came out as positive. It can be a positive early page or later page, whichever stage. Okay, that was it for this particular room. And then when you come to Kolebu itself, among the gynecological cancers that report in our gynae department, about 60% are cervical cancer related, and that is a bit. And these are people who report into the hospital. Others do not report, and so it'll be even difficult to add them to the current statistics that we have in the hospital. So that is the state now.
Okay. Cervical cancer occurs in almost 13,000 women each year in the U.S., leading to about 4,100 deaths. Since 1980, the incidence of cervical cancer has fallen by 45%, and the mortality rate for cervical cancer has declined by 49%. Survival rates among African American women are lower than for any other race or ethnic group. Sexually active women are advised to screen for early detection and treatment.